Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we are here to bring you an exciting thyroid show that Dr. Lewis is famous for because he wrote a book all about it. And we're wanting to know, if we gave you a thyroid quiz, would you pass it? So since we can't obviously talk to you in person, we're going to give it to Dr. Lewis, and we're going to see if he can pass it.
Probably not.
And then we're going to answer a lot of your questions that you guys were kind enough to write in on our Shooting Straight with Dr. Lewis, on our Green Wisdom Health page, on our newsletter. You guys all week long have been giving us questions to ask, and many were thyroid related. So we have a whole lot to get to today. So let's just start by finding out if your thyroid is healthy or not, and how to know the difference between hypo and hyperactive thyroid. It's very confusing. And if your doctor told you your thyroid's fine, but you still feel like you still have some of these symptoms after we name it off, maybe you'll understand where we go with it a little bit differently than what your medical doctor does. So let's start by talking about the thyroid quiz. What common thyroid disorder, or what thyroid disorder is most common? Dr. Lewis, is it hypothyroidism, Rydell's thyroiditis, hyperthyroidism, or thyrocell?
Oh, the most common is hypo, which means functioning less than what is normal.
And that's always something that's confusing because a lot of people think it's just the opposite, or they're treated just the opposite many times, right, at the doctor's office?
Oh, that's confusing for all of us, yes.
Yeah, they when you have hypothyroidism, it's actually under